Hi, I'm Dr. Jeffrey Edenfield. I'm the Executive Director of Medical Oncology for the Prisma Health System. I'd like to spend some time today discussing what we know about the medication ivermectin and its use for cancer. Many of you may have heard about ivermectin as it's dominated the social media feeds really for some time, starting out with COVID and suspected benefits that ivermectin might have in the treatment for that disease. Unfortunately, although there were many trials looking at ivermectin and COVID, it was not found to be beneficial. Since that time, interest from patients has expanded to look at a new role for ivermectin in the treatment of cancer. With respect to the effectiveness of ivermectin with cancer, there has been to date only one published trial about ivermectin use in human cancer. It was a study of patients with breast cancer, all of whom were treated with chemotherapy, and half the group also received ivermectin. Unfortunately, there was no improvement in the outcome of these patients with the addition of ivermectin. I think it would strike most as being unusual that there are no more published studies, which means that all of the available information is arising from anecdotes or other patient stories, none of which can be confirmed or corroborated, and many of whom are forwarded by persons who might have a financial interest in making ivermectin available for patients. The doctors at the Prisma Health Cancer Institute are very interested in you having the best possible outcome. We've noted several instances lately where standard, often highly effective treatment was foregone in favor of the use of ivermectin. This is obviously very disturbing, as we might lose persons who would otherwise benefit from standard treatment. We also firmly believe in patient autonomy and your right to choose what treatment you want. We would just like to have the conversation with you about ivermectin if you choose to have it. One other important point about ivermectin is that its metabolism is affected greatly by other drugs, and therefore it can lead to dangerous accumulation when we don't know that you're taking it. So please, if nothing else, keep the lines of communication open and inform your doctor if you're taking ivermectin. History has shown us that many miracle cures for cancer have been proposed. Unfortunately, despite all of us hoping that would be found, there is no such medication. Each of our cancers is unique just as we are. There will not be one cure for all cancers. So be careful when those who you come in contact with, either personally or via social media, purport that ivermectin is the cure for all cancer.